get all of this because this is going to be good. There we go.
Recording, so when we start. So welcome guys to Project Touch Worldwide, the place to be if you want to combine touch, therapeutic touch with pure essential oils to really make a difference. So for tonight, we have a special call here and a special lady here too. It's Annetta Cook, who has recently gone through chemo and surgery for breast cancer. And welcome, Annetta. It's so good to have you.
Thank you. Thank you.
Can you guys hear us okay? Yeah, we're doing good. Okay, awesome. So we want to talk a lot today about what oils can you use before, during, and after cancer treatment. And so I'm going to actually switch screens for a second. I'm going to share my screen because we have a little presentation there to show you guys. There we go. Can you guys see it?
Yep, it looks good.
Okay. Essential oils during and after cancer treatment, it's all there. So we'd love to have all of your comments as well. So see how if you have an experience or if you have any friends or what your thoughts are. But this is what we want to talk about tonight. This is a general overview, okay? So some of you guys will hopefully listen online or through the recording later on. We want to talk about how can you use essential oils before and during and after treatment for cancer. It is not a cure. Okay, let's make that very, very clear. The whole intention for this is because essential oils help for health. Essential oils help you feel better in your health. And they work in conjunction with any kind of treatment that the oncologist prescribes. That's the one thing I want to get out. So for tonight, there's 3 points we want to touch. First of all is frankincense and how to use it during cancer treatment, because there's always been a lot of issues, a lot of questions about that. The second one is symptom management. How can you help certain symptoms that you have? And using the touch methods and some essential oils. There's 10 that I'm going to discuss, but we'll also have Annetta's cocktails, which I think are really cool. And then, of course, the last thing is long-term recovery. What can you do long-term for your physical health, but also for that emotional support and fatigue? And really, I'm supposed to say fatigue. I just see it spelled wrong. But fatigue, that really helped, that really happens so much during cancer. And what can the essential oils do? How can they help you? How can they make you feel better? So anybody has any questions about that so far? Also online, I know we're actually going online as well. So if with the Facebook Live. So if you have any questions, then please make those as well, and we'll go and try and keep on seeing what's going on there. Okay, but any questions, guys, so far? No, we're doing good? Okay.
Good. Go for it.
So I'm going to go for a second to Annetta first, talking about frankincense. That's kind of the first thing we want to talk about. Frankincense has in the lab shown to actually change the DNA of cancer cells. There's a study. I can send it to you if you want it. You just have to let me know. It is an exciting development, okay? It is not saying that this is the cure for cancer. I'm not claiming that at all. But it is exciting, at least in the laboratory. There have been, cancer is really changes in the DNA, right? We know that we were at the center, at the cancer survivors at the Annemarie Medical Center. And the director of that did a talk. And it was a very interesting talk because he said, really, cancer is random. The more they discover about cancer, it's random, okay? It can be very encouraging for people, also a little bit discouraging because it almost feels like it can happen to anybody. But cancer is random. It is like these cells all the time we have cells that go a little bit out of whack. But there seems to be a mechanism that turns it back. Sometimes that doesn't happen. So the fact that frankincense actually has the potential to change the DNA back to the original structure is actually very encouraging. However, let's talk about also how frankincense can help just in general. So, Annetta, why did you use frankincense? Because you've been using it, right?
I have been using frankincense. I used it well before I got my diagnosis. I knew it was an oil that had a multiplicity of uses. I breast biopsies. There's bruising with it. Frankincense does very well with any type of bruise. If I have a bump and a big bruise comes up, I love to put the frankincense on it. With the breast biopsies, which led to my diagnosis, I had 3 places that were biopsied. One I could access. I could take the bandage off within a day from the biopsy, and that bruise faded. The other 2 spots, when I went to remove the bandage, it was going to pull the stereo strips. So it was almost a week before I could take those bandages off. And oh my gosh, it looked horrible. But I could put the frankincense and also use myrrh directly on it. And within a day and a half, the bruises faded. And so in terms of fighting the inflammation, you get inflammation swelling up with bruising. But to be able to see that change before my eyes, it says, yeah, it's working. And just had the 2 to compare by. So I knew that it was a strong oil in the sense of its power to change things that weren't right with the body. And just intuitively, it was something that I was using for overall wellness, even before my diagnosis. And it became a must-do after the diagnosis. There were very few days I didn't use frankincense, and I'm still using it.
Okay, awesome. Anybody has, in general, why do we use frankincense? I'd love to hear some comments about that. You can also post it on the live stream if you want to. But, and I love what Annetta said, right? It became a must. I actually use frankincense daily. I put it on my skin. I also really put it on my tongue. And for me, it's kind of preventative. I love to help it for general health. Anybody else has used it successfully? I muted some people, by the way. Go ahead, Shauna.
I use frankincense every day. I do 2 drops under my tongue twice a day. And when I forget, can you hear me okay?
Yeah. Yeah, we're doing good.
Okay. When I forget, I can feel it. My energy dips. I don't know, it like takes all the edges, it takes the edge off, of my pain. So I can really tell it's become a part of my daily routine.
Awesome. Yep. I also love it in the skin. So it's just a nice thing in the skin. But let's move on. Awesome. I love it. Okay. So I want to talk a little bit about the symptom management. So frankincense, just keep it in mind. By the way, before I forget, a lot of people don't know where frankincense comes from. It's from the boswellia tree. It's a pretty small tree, actually, and it's in the Middle East. And doTERRA sources it from Oman. And they make cuts in the tree. And then from the cuts, the tears come out, and that's how you actually make the oil, right? And so it's a very precious oil. It also was found in King Tut's tomb, and they actually didn't find the frankincense. They only found the canisters, because as his tomb was very limitedly robbed, but it was robbed actually, they apparently took the frankincense rather than the gold. So it's a very precious oil. So keep frankincense in mind as you're looking before, during, and after cancer for all these.
So doTERRA sources the frankincense from Oman, and they also actually co-impact source it from Somalia, which I think is a really neat story. So I just wanted to throw that in there too.
You want to say something about that, the Somalia story? Because I actually don't know.
Oh, absolutely. So what's really neat, and this is one of the things I love most about doTERRA, is that they do co-impact sourcing, which is where they work with developing countries and basically have a partnership there. And this is how we get some of our top quality oils. Actually, this is how we get a lot of our top quality oils. And so we work with these growers directly to get these really wonderful crops that have been grown to full term, which is how you get the complete chemical profile, which doesn't happen a lot of the time in other companies, just because it can kind of be a long process. But so that's what doTERRA is doing, is they're going to these places and paying these farmers directly so that then they can keep their crops full term, and then we get a complete chemical profile, which then leads, of course, to a really beautiful oil. And so that's what's happening with frankincense over in Somalia right now. And so doTERRA has partnered up with growers over in Somalia to get these, just this wonderful type of frankincense, because there's actually 3 top forms of frankincense that actually are used quite extensively in the essential oil market. And so doTERRA takes some of the best components of those and then makes a really beautiful oil there. So, but they partner up with Somalia, and then it does also come from Oman, just like Annemarie said. So, yeah.
Awesome. I love that. You're doing awesome. Megan, hold on a second. Hold on. Can you see this?
Yep.
Okay.
Yes. We're still on the frankincense and its potential for use with cancer. Is that where you want to be?
Yeah. I was wondering about it. So Okay. Okay. Awesome. Because I was wondering, I'm pulling something else up. I just want to make sure I get to see this.
Okay.
So,
Yep.
okay, awesome. Thank you for sharing that. That's wonderful. Let's go to the meat of this is what we're talking about. Our touch methods and essential oils, right? Besides frankincense, because I love that too. The touch method I want to put out, because I know that Annetta also has used a lot of touch method during and after her treatments as well, right?
Right.
So I just want to show this a second. We're calling it Heal with Pleasure. And that's one of the things we want to get out of tonight as well. There's so much seriousness. There's so much dread, and there's so much heartache with cancer, right? And when I was an oncology nurse, I remember the kids. I remember the kids more than anything else, because the kids were so excited still. And they would have had hard times, right? They would still have had the chemo. I worked with bone marrow transplant, pretty tough for weeks and sometimes months with these kids. But they were so resilient, and they still found the fun in life. And sometimes I think with all the seriousness that are going on, we still need that happiness, right? Mm-hmm. We still need a happy place. And so the touch methods are very therapeutic, but I also think they have a lot to do with pleasure and a lot of it fun and a lot of joy in life. So, Annetta, you want to tell a little bit about these touch methods that we've used and how they've helped you?
Yes, I have given Aroma Touch, and I have also received it, and I benefit from both. Part of it is the oil, and you can't deny the benefits that you receive from the oils during the touch sessions. However, it's connection and it's relationship. I was trained in February of last year, and that month, a dear friend of mine was diagnosed with a very rare type of cancer. It was a side effect from radiation treatment from breast cancer about 8 years previous. And she was in a bad way. Found out the diagnosis, had surgery, mastectomy the next day. She did not want to receive company. Meantime, she had breast cancer in the other breast, so it was even longer for me to get to see her. But the day I went, I happened to have oils in my car. And I just took them in on whim, and it was so profound. She wasn't a touchy-feeling person. I'm not one to invade anybody's space, but I just said toward the end of the visit, I'm learned how to use these oils. I'm taking them to hospice patients and using oils that hospice gives me with the patients, but these are my oils. And I would just like to put a few oils on your hand. She wanted to smell them all. She's the only one that did. Most people say, oh, go ahead. But we had such a sweet time together. She isn't one to hug. She wasn't one to, get real close. I loved her, but you just connect with people on different levels. After the Aroma Touch hand and doing her neck and her ears, I just sat there, and I still took her hand and I put oils on them, even though I'd finished the technique. And then we just sat there across a little card table with our hands kind of interlocked this way. And we sat there and we talked for an hour. Without the oils, it never would have happened. And I was able to eventually be able to put oils on her feet. She hadn't been sleeping. I did say, okay, we've got a rule with this one, no talking. I said, if you are very relaxed, if you should fall asleep, I'm just quietly leaving, which I did. And I talked to her later that evening. She had gotten a wonderful sleep. She hadn't been sleeping at all, and the oils did make a difference. I left her samples. She used them, and we didn't have enough time to get enough Aroma Touch in, but truly, it just deepened our relationship, our communication. She could confide in things with me, and it was just so beautiful. I wouldn't trade the experience and the opportunity to touch. And that was my very first time. It changed me initially because I wasn't the one to push something like that. But it just all worked. It really did. And I've been going at it ever since. I also took AromaTouch to another friend with stage 4 cancer. She's doing wonderful. She's in remission. And as Annemarie says, the oils do not cure, but I was able to teach her to put the oils on her feet. We did see a lot of improvement in her neuropathy. Not that she doesn't still deal with it, but the oils bring her relief. And again, another case of very deepened relationship just because of touching.
And I think, well, I believe the oils heal, right?
They can heal. The body
They
will use it.
heal.
Yes.
And what I've loved about you, Annetta, is that throughout this whole process, you've been so still giving, still doing AromaTouch everywhere you go. I'm curious though, what have you experienced? Because you have experienced all these methods. And we're talking about the hand technique, the AromaTouch technique, and then the newest one is the Master's Touch, which is a very intense, an hour and a half, deep relaxation all throughout the body with oils and with energy and with very, very specific massage methods, or touch methods, I should say. Any experience that you've had that really stands out for you from those times that you've had it?
I would say overall, you know, there's a scripture that says it's more blessed to give and receive. And my second friend, after I did the first AromaTouch with her, she thanked me for the gift of giving. And it took me a while to realize what she was saying. But in order to give, someone has to receive. And in order to receive, you have to be willing to accept a gift. And I think too often we don't allow ourselves to be a recipient of someone else's gift. And I think to have that recognized, and it has brought me to a place to accept help during this journey. I feel like, oh, if someone's taken me for a ride and they're sitting there while I'm in the doctor's, I don't know how long it is, I feel for them, and I often would not accept a ride. But I've learned to accept that with grace because it's given with love. And that's what I did to other people. In terms of receiving, just shortly after my diagnosis, Annemarie wanted to do AromaTouch on me. And she knew some of the master techniques. She was still learning. But I just felt such love. And again, that's part of the relationship with touch. It's reaching people at a deeper level and allowing a support system to grow. There are many times Annemarie was there for me. I wasn't home from surgery, but a few hours. And she spent less time at the house than it took her to get there on a Friday evening. But, oh my gosh, how appreciative it was. And it really was just rubbing the deep blue oil and some other oils on my neck, across my shoulder, down my back, which was really swollen from the affected side from surgery. But such a precious, precious gift. And like I said, I receive and I give. When I give, I'm also receiving. And 10 days after my surgery, I did the full back AromaTouch and foot on my sister who came down from Vermont. And everyone was concerned, oh, you shouldn't be doing this. Even a lady today in my house, when I'm well out of surgery, yes, I'm still dealing with a few issues. She was very concerned. Oh, now don't make it too long. I want you to be okay. I said, I wouldn't be offering if I didn't feel up to it. And once I get into it, I forget time. And that's another, you know, you could just tell I get from it as much, maybe sometimes more as I'm giving. And I'm not doing it for that reason. For me, it just comes. And I have a new friend today.
I love it because you did it today too. I was going to say
yes,
you did it today
touching,
too.
yes.
So
it's wonderful.
Awesome. Well, let's move on. I know because of time, because I know, but it has been amazing how strong you've been doing all of this, how strong you've been through all of this. And that's been one thing amazing. I want to go for a second to your wellness cocktail, because this is what you use pre-surgery. And these are some of the oils. And we, of course, we'll show some of this, but these are the oils. Megan, are we still okay with seeing the slides? Can you guys still see them?
Yep, looks great.
Awesome. So I just want to talk about some of these oils that you chose to use really before surgery and why. So anyone particular that stands out? We talked already about frankincense. But.
We did talk about frankincense, and I will, we saw the benefits from it. One thing that caught my eye on your slide was anxiety. And everybody remarked how well I got through this. Well, I had frankincense at least once every day, if not twice. I ingested it in water, but I was using it in some skin lotion before surgery. So it was truly, truly my go-to. Lemon, I heard, start the day with lemon and water. And I thought, well, why not? And it has a lot of broad benefits. My goal before surgery was to be the best I could be, have a strong immune system. Frankincense was another reason for that. And also to just boost myself as much as I could. And so these, when I was going to my friends with cancer, I read what oils should be used for treatment of breast cancer. So here I was now with breast cancer, and I thought, well, I still have surgery. I didn't know until well after surgery if I was going to have chemo. But I thought, I want to keep whatever's there contained. I don't want it, of course, when you're waiting, it seems like forever. And they just were recommended and intuitively. And I know that's hard to sell to people, that you're just doing something on a gut reaction. But my body knew better than I did. It communicated to my mind. I saw dramatic effects when I was taking Aroma Touch to my friends. I might take along a new oil. It was on the list. I really didn't know what it did, but I knew that oils cannot harm you. If your body doesn't need it, you're not going to do any harm to your body by taking that oil. But they were the ones that I was being drawn to. I just, it was at a spiritual level at that point in terms of some of the oils that I was using.
Well, and let's look at some of them also a little bit from a practical perspective, because absolutely lemon is very healing. Lemon is very detoxifying, so that really is very healthy for the body. Helichrysum, right? I think I call it a high frequency oil together with frankincense. It takes a lot of helichrysum, takes a lot of flower to make an oil for that. And it's very anti-inflammatory, it's very healing. So again, you're preparing the body for its kind of significant surgery that it needs to, because surgery is a major event for the body, right? It really is a major, has a major impact to it. And so to prepare the body before you go into surgery to have the best healing properties ready to go and the best healing state, helichrysum is absolutely something that I love that you added that to it. Oregano and On Guard are two of them that I noticed, both very antimicrobial. So surgical, right? Surgery is a place full of bugs and bacteria and viruses and everything else. So again, to have oregano and On Guard on board before you go into surgery, I can absolutely see it. Roman chamomile, just to relax, and lavender. Roman chamomile is such a beautiful oil emotionally. Who knows the meaning of Roman chamomile? There's an emotional meaning to it. You guys remember that? I don't remember it.
I
Anybody?
don't remember that one. I could go grab the book though if you want me to.
I'd love you to like grab the book and let us know.
One moment. I will be right back.
Okay, keep on. We'll keep on going. But for
I
now,
was going to say, while I was preparing for surgery, I also was recovering from major surgery that I had July the previous year. I still wasn't fully recovered from that surgery in terms of my endurance, my stamina. I mean, I did what I wanted to, but I didn't do, I couldn't do everything I used to do. And maybe that was part of why I added those in, because not only was I just trying to boost my immune system, I just wanted to be the strongest I could be going into yet another major surgery within less than a year.
awesome. Awesome, I can see that. So this is a beautiful Rosemary, by the way. I spelled it wrong, but it's Rosemary. We did this really quickly before, as we half an hour before Annetta came over. But Rosemary is also very anti-inflammatory again, and also antimicrobial. So it prepares the body as well for the surgery that's going on. And people have been amazed, I know, about how quickly you have recovered. I want to go for a moment into this idea. Because in general, the essential oils can be taken 4 ways: oral, internal, dermal, and by inhalation. So, and there is this graph here. You can't see it when you're on Facebook, but if you scroll down Project Touch, you will see it. This is something that came from Dr. Hill. Now, Annetta, by the way, went to this Pittsburgh summit. How many days after chemo?
3 days.
Yeah.
My chemo was on the 16th, and Laura graciously drove to Pittsburgh, God bless her, and I was there noontime or 1 o'clock on the 19th. So yeah, and I was, it was the place I needed to be. It really worked out very well.
It did, but that was amazing. That you could actually do that, and you could read at that time. So this is one. I just want to show the graph. And it got me back to inhalation. If you see, inhalation has a strong point. It's the time of metabolism. So how long does it stay in your body? And of course, when you inhale it through a diffuser, if you really kind of inhale the essential oils, it will have a very strong, stable level. And so in terms of recovery after cancer treatment, that's something I definitely recommend, is to have a diffuser running, right? And so you can have a straight and a really strong, continuous level of essential oil inside your body. A dermal has a little bit more of a bell curve, and internal and oral, of course, it starts really high and it quickly goes down. But I do like internal use of these oils as well. Did you use a lot of the oils dermally, topically, or some internally as well? How did you use them?
The ones I used topically was mainly around my incision area and where there was a lot of swelling. Again, through the chest area, certainly the back, under the arms, the back of the arms. And I continue to use them. That swelling hasn't completely gone away. It's something that hangs on long after a surgery. Even my knees, which were replaced a few years back, they can swell up. And it's just major trauma to your body, and it doesn't take much to just, I don't know, re-injure it, overdo it. And so I try to keep steady with that and continue to use the oils around the surgical area. I'm also starting to use oils on my arm for some lymph fluid issue, and I'm seeing dramatic results.
Awesome. And I just pulled this up, if you can see it. Frankincense, sorry, misspelled again. Frankincense, myrrh, helix, and lavender, and oregano is what Annetta used in a cream below and above the surgical site. Oregano is a little bit risky in there. She did well with it. It is very good antimicrobial, right? We talked about that. It is also very hot oil. So if you do use any oregano on the skin, please dilute it and put it in a cream or put it in a little bit of oil so it's not too strong. But it worked for you.
It did. And I made up a jar probably 3 tablespoons of lotion and I put all these oils in it, but I only put 1 drop of the oregano.
Okay.
And, you know, it's more generous with the other oils. My concern with using the oils in a cream after surgery, first and foremost, was infection. I had heard that, I mean, it's a large incision. There were drains involved, and so I still had an open area, not very large, but just a small area on each side where a drainage tube came out of my body. And every time I had to, you know, clean the drains, express the fluid down into the reservoir, I was very careful to apply lavender directly around the area where it came out. I did not have any infection. In fact, I didn't even get infection one time when a tube came out, and without thinking, I pushed it back up in. I did have to go on antibiotics, but I attribute lavender, especially keeping the infection, took care of any organisms that might have threatened my body. That is a concern from the type of surgery I had, and it's not unusual to have infections. And I did very well, very well.
Awesome.
I also, you know, inflammation was an issue, the edema from the trauma. So there were many reasons that I chose those oils. Well, major reasons: the infection, inflammation, and then edema. Aside from, I mean, there's a difference in it. And the oils, just, I could tell by the fit of my clothes that they were working.
I love it. Megan, did you ever find out about Roman chamomile?
I sure did. So Roman chamomile is the oil of spiritual purpose. And so this is to promote purpose, so help you be more purposeful, to feel guided, to be peaceful, fulfilled, relaxed, a little bit important there, and then to have divine connection. So it's a very cool oil.
Very beautiful. I love it.
Yes.
I want to go for a second into, thank you, Megan. That's awesome. I don't know if you can see this. Can you see this, Megan? If I hold this up?
Yep.
The home essential kit? Okay.
Oh, I can't believe you guys get to see each other.
What?
I couldn't get the Zoom to work, so I'm dialed in. So now I'm all jealous that you're putting up slides and can see each other.
Oh, I'm sorry. We'll definitely have a
I don't know.
But try and get into Zoom again. See if you can click on the link again.
All right. Well, you know what? I'm going to go to the desktop. It's right here.
Okay.
Maybe I'll see more.
Okay. What I'm putting up is the Home Essentials Kit. So for a moment, I want to talk about this piece. Purity, sourcing, and testing matters. So for those of you who are using doTERRA essential oils, awesome. You guys all know it. This is going to some people who actually are also not using doTERRA or not familiar with it. Some of those recordings, I just want to put this up. Purity, sourcing, and testing matters. It really does. Purity of the oil absolutely matters. Anybody wants to say something about that? Because I could go forever about that, but anybody?
Just say, what do you want said? Because yes, this is a really in-depth topic.
So why does it matter, purity? Why does purity matter?
So purity absolutely matters, because if you have any kind of adulterants inside of your essential oil, then it's not going to work effectively. It's not going to work in the way that it's intended to. Also, if you look at the ingredients, like if it's, you know, if those are synthetic ingredients, it's also not going to have the same effect in your body. It may actually harm your body a little bit. And so you really do want to be careful about what you're taking into your body. And so most essential oils, you cannot take them internally because a lot of them are, they do have a lot of different fillers in there that are with the oil. And so you do not have a 100% pure essential oil there, or it might even be synthetic. And so you do want 100% pure therapeutic grade essential oil. And so doTERRA really does have, you know, really does have the most wonderful essential oils there. They really do have the very best available because of course they're pure. There is nothing else in that bottle of oil. And then as we commented on a little bit earlier, these oils are coming from plants that are sourced from their native lands. And so and then they are also grown to the complete time. You know, they're grown to the optimal time so that then you're getting a complete chemical profile there. And so really all of those little things add up to creating one amazing product, and every step of that process absolutely matters.
Awesome. Love
I would say with the purity, the one thing that sold me on the company, I approached very cautiously. I love the education. I love the ease with what I could read the materials. I could find answers to my questions. But when they emailed out the property wheel that showed the major chemicals in each of the oils, and then what that particular substance did, was uplifting, or it was calming, it was anti-inflammatory, it was antibacterial, antifungal. It was like, here is what makes it work. And that is what's in some of the RX, the medicines we buy, the prescriptions. They're chemicals, but they're designed to function in the body a certain way. Well, these natural substances from plants, if we're getting them in pure forms, they're readily available to our bodies. But doTERRA came out and they say, okay, here is what is in the bottle that you get. Their lab tests support that, and they're willing to tell you the specific chemical that is providing a benefit to the body. It reduces the level of harm that you're experiencing as a symptom. And it's not mixing in with other ingredients, which not only dilute it, but there could be an interaction which then in turns makes the active part of the essential oil not available to the body. And that is what convinced me about using the oils. It was their openness and purity. The word says it all. And truly, there's nothing to refute that I have seen.
Awesome. Love that. So yeah, just a little bit of a side there and how it matters. And you know, I was thinking about what can we use for symptom management, right? What would I recommend for somebody who comes to me and say, hey, I want to use essential oils. And I have cancer treatment coming up. So I gave you guys a couple of ideas with Annetta. I also just want to talk about this kit, because it still is my absolute favorite kit to recommend to anybody, anytime, is the Home Essentials kit. And I was thinking about it, all the symptoms that I know that cancer patients have, right? Just from my experience as an oncology nurse. And there's so many things that you can use from this Home Essentials kit. We're going to also go into the supplements a little bit in a minute. But this is really, I feel like, one of the biggest things you could use as you're going through chemotherapy, through surgery, through radiation, or any of the other treatments for cancer that do exist, because there's other ones. And I'm sure we'll have a follow-up at one point to talk a little more specific, but I just want to get the broadness out today. Don't worry about this 10% if you're looking at this graph. It's just the way I got the 10 oils on there. But I'm just going to go quickly through them, but I want to go through some of the symptoms that people have. So here we go. So post-surgery we already talked a little bit more about. We didn't talk much about Deep Blue yet, and I'm just going to hold up Deep Blue. Deep Blue is one of my favorites. Deep Blue is very anti-inflammatory, has wintergreen in it, has helichrysum, very healing. Wintergreen is also analgesic. So what else has it in it? It's peppermint in it. It has blue tansy in it, which all is very relaxing. So I think after surgery, it's a wonderful way to actually recover from surgery, from any kind of surgery, but especially also from cancer surgery. Just for a moment into GI support, nausea and vomiting. Did you have a lot of nausea?
I had none from the surgery. With the chemo, I would say it was mild. I never got to the point that I just felt like I was going to lose everything. It was more a subtle feeling. Some of it was vertigo-like. It was like everything remained calm, but as soon as I moved, everything started rolling in my stomach. And I was using the, I used ginger peppermint digestion when things got really bad. I was ingesting them. In retrospect, I probably should have put them on my abdominal area. I've used digestion before that way. I didn't do it that way. I did have a prescription medicine, and I just didn't want to get to a point that I was going to be really bad off with it. So I did take the prescribed medicine with side effects, but it did work very, very well for me. But it was there in my purse.
Okay.
Hold on. There you go. Hello? You can't see me.
Can't see you, we can hear you.
All right. That's the best we can do. That's exciting.
Okay, go
But
ahead.
really, I did not have that much problem. If anything, it was all within the first 5 to 6 days. And I was fortunate in that regard.
Yeah, I love that. So digestion, by the way, she mentioned it. Peppermint is another really good one. You can take these internally. Both digestion is one of my favorites, but it has fennel, right? It has fennel. It has ginger in it, like Annetta mentioned. Very, very good for all that post-chemo, post-surgery nausea. And you can put it externally very nicely. Don't forget that we have such an easy way to the brain with these oils, right? The minute we smell them, they immediately go through the olfactory nerve into our limbic system, and they help with emotional support, but also just in general telling our brain we're okay. So I think that really helps too.
And I will say, I got peppermint on a regular basis. I suffer from dry mouth before chemo. And I love the little beadlets. Often I'm sucking on them. So that may be one reason I didn't have that much issue with it, because it's something I'm popping in often.
I love that. Immune support, oregano, melaleuca, really talked about. On Guard is in that same kit as well. So it's another awesome oil, antiviral, antifungal, antibacterial. There's a study by Hopkins recently, which we often talk about, but in case you haven't heard it, it actually came out saying that essential oils may be a very good option in the future for superbugs. And so when that came out a few months ago in the Journal of Infectious Diseases, we were all like, yes. So again, because of chemotherapy, right, reducing your immunity so much, this is a way to boost the immune system and help the immune system. That's the one thing I remember as an oncology nurse working with bone transplant patients. That's one of our biggest concerns, right? Is all those internal as well as external viruses and microbials that we have in our bodies and outside our bodies. Well, this is a very natural way with clove and cinnamon and oregano and tea tree to kind of help you and make sure you don't get sick. And I don't think you've gotten sick through this whole heavy.
The only time I was sick and I was ready to give up on chemo after the first one, I had the flu. I was getting over a bad cold, and truly I had all the flu-like symptoms. None of those appeared in the other 3 chemos. So that was the only time, but I attributed it all to chemo while I was experiencing it. But it was like a light switch was turned, and I was better the next day, and never to have that again.
One day.
Yeah.
I'll take that one. Respiratory health. Again, we want to keep our respiration really strong, right? So breathe is another beautiful one to put into the diffuser to kind of help that too.
I was using that when I went in, and I did have a reaction with one of the, I received 2 different chemo drugs, and 10 minutes into the start of one of them, I got a spasm in my throat, and it did not stop during the first one. And there I was sitting in among other people, very sick, coughing my head off. I took Melissa with me the next time, and I just put it right lightly on my throat, just kind of at the base where it goes inward. And immediately it stopped it. So that was a drug that went, or an oil that I took into chemo, and I used it. Now, the oncologist suggested that I take an over-the-counter antihistamine. I did it, but when the cough started and I could put Melissa right on me and the cough stopped, I just was so grateful to know that Melissa, which is often used for depression, can also stop spasms, be it in the gut, which is what I first heard about. But when I had these spasms in my throat, I thought, it works elsewhere in the body, will it work here? And it certainly did.
Awesome. And Melissa's beautiful oil. Comes from all the way from Bulgaria. So, and you're right, it's used for depression a lot. So
yes,
it's a beautiful one too. Okay, focus. I know you've used so neurological, right? You've talked about having chemo brain.
Oh, I have. I would go into the kitchen to fix dinner, and I didn't even know how to measure or to pour something. I said, let's go out to eat, or thank goodness for Ed. He stepped in many a time. I was so bad, I couldn't even think what oils to use. and you know, it was, I truly was non-functional. It was very, very discouraging. When I got over just this fog that truly, brain freeze is another way to call it, I do love to use Intune, which is called Focus Blend. And I am best in the morning for keeping any kind of focus, keeping any continuity to a thought or discussion. But with the Focus Blend, it just really sharpens my senses and gives me the focus that I'm seeking. And I've been on medicine for ADD. I'm starting to think I'm ready to cut back on that in my good times, I really, really found focus like I never did before. I think I just need to coach Ed to tell me when I'm acting like this, bring this oil to me.
So he can help. That's a beautiful one.
Yes.
I want to go to detox hormonal. We're kind of running a little bit short of time. I do want to go to the emotional support. So we'll go for that. Sleep, there's several oils for sleep, including lavender, which is also in the kit, and Serenity, which is also beautiful.
Yeah,
right?
I've enjoyed using that. With the hormonal, I will say I had a lot of just sweats that came on. There were times that my sweat glands weren't working, and if you've got body heat and you can't get rid of it through sweating, it's a horrible experience. But even with the sweats, I would use Clary Sage. I like to put it right here, a little further down, kind of like between, I don't know what you call this area, but just above the thyroid. And I got great results for keeping an evenness of body temperature. So yes.
Nice.
And that ties in some with hormone support, but it's just the way my body is, and chemo made it worse.
Okay. Awesome. I want to go to the emotional blend, and then let's finish up with supplements and see if there's any questions people have. So emotional support, I just put 6 oils that doTERRA has put out, right, with emotions. And please come another time and learn more about them. How you have your own emotions that you use. I'm calling it Annetta's emotional support cocktail. Tell us a little bit about, I know you love the citrus oils. What has been your support? What have you really loved?
The citrus oils are very uplifting for me. They bring a smile to my face. I can't explain it any other way. Among the oils that are in the kit, I really like cheer. It's like sunshine in a bottle. So on a dreary day, it does, pick up my spirits, motivate, which is another one of the emotional oils. I just sometimes can't get going. It's just, I just have to do it. I fret and I think about it longer than it takes to do the task. Motivate, when I use it, I get quickly through a task. I move from one task to another and just feel like I get a lot accomplished. That's part of the depression that I've dealt with since I was introduced to the oils. I've cut back with my doctor's support, 2/3 of my antidepressant medicine. And the cheer and the motivate, I find, are working very well to help me keep my spirits high and not depend on the prescription medicines. And in tune, we talked about just to help with focus.
Awesome. And what I love what you said is, I mean, we know that these oils have a very immediate effect on the brain, right?
Mm-hmm.
They have a physical effect on the brain. I think I want us to understand that it's not just fantasy. It's not just a nice smell. It
Mm-hmm.
really changes the chemistry in your brain. It changes the neurotransmitters. We know that it has an effect on dopamine and a lot of other neurotransmitters
Mm-hmm.
as well. And what a wonderful way to use this yourself. Again, it's not something that you need physician's prescription for or anything like that.
Mm-hmm.
These oils, these emotional oils, and there's more than that, because peppermint and, like you said, the citrus oils are absolutely also emotional
Mm-hmm.
affected. But you can use them. You can
Mm-hmm.
use them on yourself. You can just grab them, put them in on your neck, in the diffuser, right? And feel better.
I did try to use Forgive just quickly. That is the oil about giving up control. And I do love to control my world and my life. And when I had to make the decision about chemotherapy, it was like, if I'm on the yes side, I felt better than when I said, no, I'm not going to do it. And so I was back and forth, and I thought, well, I'm going to give up control. I'm going to go to use Forgive. I had 3 horrible days because I was fighting the way that oil wanted to work in my body. My will was so strong. You talk about mind over matter. And I really do want to go back and try and use the oil. But I truly was in a struggle with myself, and it was not fun. And if anything, it taught me I just had to let go and to trust. So it didn't work the way I wanted it to, but it taught me a powerful lesson. So there were other things going on. It may not have been the right time. Sometimes your body's not ready, or it doesn't need the oil, and maybe I thought it was going to be a panacea for me, but I still was struggling, and then that made it even worse. So, but you can get powerful, powerful reactions. That was the only negative one, and like I said, I've got to work on let go.
Oh,
I do.
Perfect, but
I do.
I want to go into this last piece of it before it's 8 o'clock, and that's long-term recovery. You've had your last chemo, and I just want to go into these little vitamins here, because I think if you look at, so this one really quickly, the long life vitality. A lot of people complain long-term about fatigue. It takes a long time, sometimes people say, to get back to how they felt before, or they want to even feel more energy. Most of us in our team have used long life vitality a lot. And honestly, I, in the last couple of months, have started using it much more regular than before. Felt an enormous amount in my energy. I already was at a high energy, but it feels like it's going out of the wazoo nowadays. And so when you, especially after cancer treatment, but also during, I know you've used these during too. So you want to say a little bit more about kind of these. We've talked about Deep Blue already, but especially the PB assist, the GX assist, and the lifelong vitality especially. What do you think made a difference?
Well, with the lifelong vitality, I just started that in January. It was something I had planned to do. So it kind of coincided with my cancer diagnosis and journey. But I had seen a difference in my husband. He was dreading winter. He would suffer from SAD. He just got depressed. And I thought, let's try these. And he noticed a difference. He would have a lot of fatigue, boredom, whatever. But I knew he was perked up more. I could see a difference in myself. And during my post-surgery and during chemo, I did double up on what I was taking. But I added in others. Some I had used before, the PB Assist is for probiotics. I had strong antibiotics during my surgery. I didn't need them afterwards. But that, of course, destroyed everything in the intestinal flora. So I needed to get that restored. It very quickly was restored. I have some sensitivity to dairy products and a few other food products. And I really have not had any lactose issues since I've started the PB Assist. The GX Assist is a detox product. You take it for 10 days and it just clears the liver and the kidneys, other organs, just kind of flushes them of any thing that is causing stagnation that's just lingering there. I waited easily 5 days or more after my chemo, after I was told all of the chemical was out of my body. Yes, there had been cell damage, but I wanted to detox. My last chemo, I've had a lot of issues with swelling and itching. They thought maybe it was from liver overload, and I did have a blood test. Everything's fine. So I would say I'm dealing with something in my body, but at least my liver was healthy. And I always got good report on kidney and liver function. And I just didn't want to be worn down with them not functioning well. I always had good numbers. Also had excellent blood counts. And I just think it was the wellness component. And lifelong vitality is also part of that. When we started taking Lifelong Vitality, that's the vitamin and mineral supplements. It is EO Mega. It is the only omega product that I can take without any adverse reaction. I even tried flax seeds, and I'm allergic to it, so I had all kinds of intestinal issues and medical issues from trying something like flax. It's the only product where I feel like I'm getting the omega fatty acids in my body, and I have no problems. So I just love those products. They do have essential oils in them, as well as natural forms of the vitamins and minerals. When we were making the switch to Lifelong Vitality, we were taking glucosamine, other joint complexes, and still complaining of aches and pains. We switched to Deep Blue, and I do suffer from severe arthritis. There are going to be days that I have aches and pains, but absolutely love that product. It used to be I had to take a homeopathic on days when rain was coming in. I just ached all over. I rarely have to resort to that product after being on Deep Blue. So it really helps me, pain in your joints, you're not functioning. But that also was, important to me not to be in pain just from arthritis.
Awesome. Awesome. Thank you, dear. And this is Deep Blue, by the way, for some of you. Okay, we're coming to the end. If you're on Facebook and you like what Annetta said, give us some hearts, give us some nice shout outs, leave a comment if you like this presentation, because guess what? More of your friends will see it. And we want to give this to other people, right? Most of you are who are on this call are on doTERRA. If you're not, please go to the person who gave this call to you, who referred you, because we'd love to help you. Our biggest goal in life right now, and that is Annetta's goal as well, as she's been doing throughout the chemo, is helping people through the oils and through touch, really change their lives, right? And so, Megan, give us some hearts, girls. I see you going on Facebook Live, so give us some hearts, because I'd love to see it. Thank you, guys. But this is what I want to kind of end with. This is our team, part of our team. It's not our whole entire team, but we actually had a day at the beach and we had an awesome time. And what I put in there, emotional support for families, touch methods are also for families. in general, right? We need to take care of our families as well. And so think about that as you're thinking about essential oils during and after after treatment for cancer. Also think about families. And a lot of families can often have the extra support. They need the extra support. This is our family. We'd love for you to join us. We'd love for you to try the oils. And if you have any questions, please contact me, contact us. ProjectTouchWorldwide.com is on the website. It's our website. We also have a very active Facebook group called Project Touch. You can request to be part of that. Whoever kind of referred you, please let us know. Thank you, Megan. You said, I love this presentation, Annetta and Annemarie. Thank you, Megan. Leave some comments, guys. Thank you for being on this call. Annetta, thank you so much. You have been amazing through it all. I really mean that.
Well, and the team is my family. They have been very supportive. There isn't I don't put up many posts, but I just love the comments and encouragements I get when I come to a meeting or a workshop. The hugs, just the support, just your words of encouragement. And that's what I was trying to explain about reaching out to people, that it just happens so naturally. I mean, you're using the oils with people, you're putting them on their hands, their back, but it goes deeper than the oils. It goes into relationships, into community, family, real family, where we love one another and we look after each other.
Absolutely.
And if I can help anyone in any way, I just love giving Aroma Touch. I still am fine-tuning some of my approaches. Always get wonderful comments afterwards, but I just feel like there's more I could do. I'm on the Project Touch Worldwide website now. Thank you, Shanna. And if you have any questions about cancer, you can reach me through that. I'm here.
Awesome.
At any level, especially to support those with cancer.
Awesome. And awesome. Well, we'll leave it at that. Please remember to share this with your friends and family. If there's one testimonial, which I have had from Annette, I just want to mention this real quick. She didn't only keep on reaching out to people. She actually took a whole course. Well, Mao from Cape Verde, our massage therapist, came over to teach us Master Touch. She took a whole course. And it's been amazing to me. This lady has just been working with an acupuncturist, teaching classes, doing Aroma Touches, all while going through chemotherapy. Most people would have been like, okay, I'm going to relax. I need some time. She's just kept on going 1 or 2 days after she was at the convention. You've had such a passion for this. I mean, I love you. You are amazing. Thank you. It's been good.
And I've come when I felt my worst, and I leave so much better. And I do want to say I had a wonderful team of doctors and staff at Anne Arundel Medical. They were very supportive of me using the essential oils. The one comment that I got was not to ingest any prior to my surgery, and that there wasn't enough information in with how it would affect blood clotting, and certainly not being able to, to control the bleeding is a legitimate concern. But I could use them topically and aromatically. And just before my last chemo, my oncologist, what Annemarie said, I did come through this very well. The last one was a struggle. Y'all didn't see me. I just didn't feel like coming out. But I said, I feel kind of glib. It was too easy. And it isn't to say that I wasn't without symptoms, that I wish things were different. But it wasn't the horror stories that I heard from a lot of people. And he said people that are into wellness, he finds among his patients, they do very, very well. And those that use essential oils do the best. And I said, well, if I don't know what I'm going to do, I don't see myself doing a cancer support group in the sense of what you think of support groups, but I want to be there to share an oil that could just lift somebody's spirit, to just be a presence for them. People are lonely, and just being a presence with them is sometimes all that they need. It's kind of the direction I feel like I want to go. And I said, would you support me in this? And he said, oh, sure. So I do feel like I have an ally in the medical field. I just need to come up with a proposal. I'm not even certain what I would ask him, but I'm just grateful for the support and the encouragement from the medical staff.
Awesome. They're coming along. More and more oncologists.
Right. And
more
the main thing is, and rightly so, they need to see the research. And it's hard to get studies with humans. There's a lot of extrapolation. My career dealt with a lot of that on the nutrition side, of where there's studies with animals and you extrapolate to humans. But with treatments and serious diseases, there are certain protocols to follow. I respect that. But there is an openness now to explore, and that is a good beginning. Awesome. It's not like, no, this is the ancient practice of medicine.
Right.
There's so much known, and just like I said earlier, we know what the chemicals are. We know how they affect metabolic pathways, affect our bodies at all levels. Mm-hmm. Because drugs companies have used chemicals and proven that. And a chemical is a chemical.
No, absolutely.
We're just getting them from natural sources.
I want to go for a second, see if there's any more questions. I know we have quite a few people on the call. Any more questions, guys, before we finish up? Because I honestly think the comment was an awesome one from the oncologist. So that the people who use essential oils do the best. And so Annetta's done a wonderful job tonight. Any questions, guys, for Annetta? Just speak up. No? Okay. All right, well, I'm going to finish here. Thanks so much for being on the call. Like I said, please share this with people who you know who could use it. There's a lot of people out there who could use the support of these essential oils while they're going through probably one of the biggest trials in their lives. Again, thanks, Annetta.
Thank you. Thank you.
And we'll talk to each other soon.
I didn't have a question. However, I just want to say, Annetta, you are a boss. Like, you're awesome. And this was an awesome presentation. So
thank you. It was my first.
You did wonderful. And that was awesome information. So thank you very much. And seriously, keep up your spirits, because, I mean, you're awesome. I swear, like, you're an inspiration to everybody. So keep going.
I found them. They had been lost for a while. So I'm going to hang on to them. Thank you.
Awesome, guys. Well, we'll see each other, everybody, tomorrow again. Come on a 6 a.m. call again, or the 12 noon call. We have one at 12 noon as well. Thanks for being here, and we'll talk soon. Okay. Bye, guys.
Thank you. Bye.
Bye. Thank you all for calling in.
Stop this.